Hello, my name is Tamara Plummer. I'm a program officer in the U.S. Disaster Program, and I'm here today to talk with Cathy Slemp, and I will let her introduce herself.
Thanks, Tamara. I'm Cathy Slemp. I am a public health physician who has worked mostly in government agencies at the state level, served as our state health officer for quite a while in West Virginia here, and most recently have served as state health officer during the COVID pandemic until just about a month or so ago. So have done lots of work in this arena.
Welcome, Cathy. I guess where I want to start is, what is public health? I feel like we've been having lots of public health officials say, what is a public health official? What is your job?
Well, public health is the study of disease in populations. So rather than individual care, we think about the health of a whole population. And one of those areas is the spread of infectious disease in populations. And so that's where it becomes most relevant in this arena. And so that's an area that public health every day, whether it's HIV or sexually transmitted diseases or immunization programs or tuberculosis. Hepatitis is a big one we deal with. And so one of the areas that public health has been thinking about for a long time is pandemics, and done work and planning in that arena. And this has now come to fruition, and we're seeing it, of course, in an unprecedented way, much bigger than we'd ever wished we could, but we knew could happen. And so public health thinks about those things and how to respond to that, how to partner with others.
Yeah, it's I remember meeting you several years ago and you talking a lot about the work that you were doing with Johns Hopkins around the Copewell model of filling your tank, emptying your tank, that we have now revised to online training for church folks to think about their personal resilience. And now I'm glad that I had that experience to know what a public health official did long before the pandemic came along. So grateful for the work that you do.
Thanks. Resilience is so interesting because I think what we learn is that the way our communities function every day makes a real difference in disasters. So if you have a well-functioning community and people are connected and linked, if your churches are actively engaged in your communities, and you've got good communications between government and you've got trust with people and systems that work and that engage your community, if you are addressing vulnerable populations every day, and equity, those all really are great supports, and they lay the groundwork for being able to respond well to disasters, such as pandemics. And so I think that everyday work, which is really the everyday work of public health and of churches, frankly, really lay the groundwork, being able to respond better both every day and have more create effective communities and able to we do that community transformation work every day, and that lays the groundwork for a disaster and emergency like COVID-19.
Yeah, can you say a little bit more about that? I think sometimes people think that like Black Lives Matter protests or fighting poor people's campaign work might distract us from engaging in pandemic work, but can you say how that equity and addressing poverty and stuff like that helps to support building that resiliency?
Yeah, well, I think when we have emergencies and disasters, they uncover existing challenges in systems. And so, COVID-19 has just uncovered some of the disparities, the equity issues that we've known for a long time. Communities that don't have good access to healthcare or don't trust the healthcare system because of or other factors that just make it very difficult sometimes to navigate. And so I think these situations bring those to light again. And make us aware of it in new and different ways. We think about, for example, low-income workers or who may be the bulk of many of our essential services, or don't have their own transportation systems, so they rely on public transportation systems and then get exposed more commonly. And so we have groups that are high risk And so this gives us a chance to really identify again those areas and commit more fully to addressing what are really systemic long-term problems in our communities. So I think those are important. You know, I also think one of the areas you asked about why and what is public health, and I think public health we believe that the science matters and that we use the information and the data, whether it be around health disparities or whether it be around how the disease spreads, to guide our actions and to move forward, to test out systems and to try something new and different. And if it works, to continue. If it doesn't work, to learn and to move on from that. So I think the other thing with science is we are, and in public health as well, of course, we're open to learning more and evolving our actions, our implementation based on our experiences. And I think that's a key area to think about with that. The other thing I think with public health and any disaster, this is so important, is communication. Clear communication, and there's a whole art around risk communication, how to communicate in disasters, that people are often trained in public health, but not more broadly in society sometimes. And so those have been really, there's some core principles, and we as church leaders can use those principles. It's important that we don't speak to what we don't know yet, but that we commit to finding out. It's important that we always be truthful and be clear about what we know, what we don't know. It's important that people know that you care before they care what you. And so that reaching out and being empathetic with folks. And then I think so importantly, and I think this is an area we've not always done well with this pandemic, is to speak to the fact that that's a good thing. Because when we see guidance change, it means we actually are learning more and applying that knowledge. So it's not a bad thing. It's actually good. We're learning more, we are evolving what we do, and we're coming together moving forward together. And so that's, I think, one of the areas that can be effectively done through churches or through public health officials and others. But it's critical that we do that. But public health can't do this alone. We have got to, this is really about all of us together. This pandemic is much bigger than any one sector. And so that is why it is so important that it's got partnership with other agencies, with healthcare systems, emergency management, faith-based communities, businesses, and commitment from leadership, because those all make a difference. But at the end of the day, you've got to have public engagement and trust. And that's areas that we've often had challenges here with that, but things that we can work together to strengthen our communities.
Yeah, it sounds like you're saying that how we are in relationship before the bad thing happens will help to boost or limit our ability to respond after the bad thing has happened. And so I appreciate you reiterating what we've always been saying from our end, but it's good to have another voice.
Well, the other thing is, I think sometimes these events call us to come together in a new way. And so if we haven't gotten it all done ahead of time, and it's always an evolving process. This also has a chance to bring us together in ways to say, hey, we can do this and we need to do it effectively.
Yeah, if you haven't been in a relationship before, maybe you can have a new relationship that was never possible before.
Absolutely.
I love that. So I want to switch to some just PSAs for folks. We have learned, I was just listening to an interview with Dr. Fauci, and he was talking about how some of our safety protocols have evolved over time as we have learned more and more about this disease of COVID-19. So today, we're currently filming on July 27th, 2020, and there's some surging cases in certain parts of the country, lower cases in others, but at this point, we're probably going to be at 150,000 deaths in the next couple days. And as someone who's lost someone to this disease and seen other people lose folks, it's it's a whole nother level of loss. What do we need to do to not see refrigerated trucks, to not have to kind of deal with the harshest parts of COVID-19 and keep ourselves and our families and our loved ones safe?
Absolutely. Wow, and it has been such a traumatic experience for so many, in so many communities, as yours essentially too, has really seen the incredible impact it can have. While most people tend to get over the virus, sometimes it still has long-term effects for them. And so many of us know folks who have had it and have not gotten through it. And it is both terrifying and incredibly overwhelming to see what can happen in communities. So, I think that reiterates the importance of coming together to do what we can. I think we as a society tend to want to have a quick fix. There's, we can just take a pill, or there's a vaccine immediately, or somebody else has to take action, not us. If those other folks would just quarantine, we'd be okay. And I think, it's more than that. It's as community. And it's challenging when the fixes that we have are really our own behaviors and about changing social norms. But they are things that, frankly, that gives us a lot of power as individuals. So it does take all of us coming together individually and collectively and supporting each other in taking those prevention measures that can make a difference. And the good news is there are things we know that work. And they really are based on some basic principles of how this disease spreads. So we know that that the virus has to get into our mucous membranes. So usually our eyes, nose, mouth, for us to get infected, not just landing on our skin somewhere, but it has to get internal to us. And so we think about how it spreads. And so it's respiratory droplet. When you cough and sneeze and those little droplets go usually about 6 feet away or so. And that's why the distance piece of 6 feet. So it's usually that time before they drop and fall. There may be some aerosol transmission, some airborne transmission, the smaller droplets that stay around a little longer. And so that's why we think about ventilation being important as a key thing. And then the final area, less commonly, though probably important still, is that you pick it up off of a surface and then put it in your eyes or mouth with your hands. And so that's that good hand washing kind of things. So all of those methods of spread are the reasons why we have those prevention measures. So masks. Masks are the one that we hear about.
Let's talk about the mask, Cathy.
It's such an interesting area. And, masks protect others because when you cough or sneeze, they capture those droplets that would be projected more. So that kind of blocks it. Not 100%, but it blocks it a fair amount. And so we know, and have always known, and you heard from the beginning of the pandemic, that the sick person needs to wear the mask. What we've learned since that time is you can have the virus and spread it without knowing you have the infection. And so that's why if everyone wears a mask, it prevents disease spread with that.
So I just want to clarify, I am wearing the mask to protect everybody else around me. I am not wearing my mask to protect myself. So if you think that, like, I've seen people like, well, I'm young and I'm healthy and I haven't really done anything, so I'm just not going to wear a mask.
Well, it's twofold, interestingly, and this is an example where we're learning. So the mask definitely protects other people. We know that it helps to prevent that spread of respiratory droplets and that projection of virus out, whether or not you have symptoms, because you don't know if you're infected or not. So it protects others. When I wear a mask, it protects you, no doubt. But interestingly, what we're now learning is it probably also protects you as well. So actually, it's both ways now. We know it protects others, but there's also some evidence that it actually protects us as well, whether it's because those droplets don't fall, they can't have access to our nose or mouth area, Whether it's that we put our hand in our mouth less, don't know, but it actually seems to be protective both ways now. So that's actually a reason to do it for others and for yourself with that. We are aiming for 80 to 90% of our population wearing a mask, because if we can do that, we know that we really see disease spread drop. And so we've actually had evidence now that communities that have broad masking have decreased their disease transmission rate significantly. So we do think that's an important piece. It's not the only piece. It goes in conjunction with other things, but it's important to use a mask, especially if you can't be that 6 to 8 feet apart from someone else, or if you're going to be in a shared space inside for a long time period, then it's probably very, very important. So masking is one. And then there's others as well. There's the whole area of physical distancing. And I really like to call it physical rather than social distancing, because we want to stay connected socially. It's about being physically separated apart to some extent. And so that's that goal of at least 6 feet or so from others. And to avoid crowds and large public settings, to limit our activities to essential activities when we go out. And to think about travel. Do we really need to travel to a community that is higher incidence than ours? Or if we're traveling, what's the role with airplanes and those kind of small enclosed settings? How do we minimize those risks? So it's not that you never travel, but to think about the issues around travel, when you need to, when you don't. So that's important. I think ventilation is another key one. So if you're in the car and you're worried about exposure with someone else, opening the windows of the school bus if they open, church outside, other activities outside. We know that outside is a safer environment than inside with that. So that ventilation piece is really important. And then the good environmental cleaning and hand washing that we know is also effective with that. I think besides what is also what we can do that is important to talk about. There's plenty of activities that we can do as well. So it's the getting out and enjoying nature and doing those things that feed our soul as well as our bodies with those things. Yeah.
So I'm hearing all the same messaging that we've gotten from other public officials. And so I want to now concentrate on the church. What do you think the church is being called to do right now? I mean, there's multiple disasters happening. We're in the middle of hurricane season. There's folks really trying to fight against institutional racism. There is a global pandemic. There is an economic crisis. And I think there's also a mental health crisis happening for a lot of us. And just the compounding for those who are most marginalized in our society, really feeling the harshest brunts of all of those things happening. What are we as church being called to do?
Yeah, well, what a wonderful question. In such an important area. And the church is clearly more than the building. It is really about, and we are called to serve each other and our community, whether or not we are gathered in a building. No doubt. And so ministry in the church continues whether or not we're together to worship together physically. And so we really continue that work. So I think we could speak about both the work of the church in community and the work of the church together in worship. And I think they're both really important because they feed each other. So in the community, I think just like we talk about in other disaster preparedness, emergency readiness work that we do with communities, it is about connecting and supporting the communities that you are already linked to and that you know. So you know folks and have trust with folks in your community work that you do. So whether it is work with Hispanic communities or communities of color around racism, or whether it is elderly populations that are at risk, or low-income populations that need support as they try to do essential services. You've got communities that you are linked to, or that these are opportunities to now develop a relationship with. that you really can listen to, hear what the needs are, and look at both of your strengths and put them together. I think those same asset-based community development principles that we talk about otherwise apply in pandemics. So it's not just about delivering services, it is really about connecting with folks, finding shared areas that you care about, and what you each can bring, what do folks already have in their toolbox that they can apply to it, that you can support and add from as well. So I think there's a ton of work that can be done there, whether it's around food supplies or whether it is around supporting small businesses and helping maintain financial stability through the pandemic, or emotional supports as you reach out and support each other. I think it's challenging for our church members being isolated, as well as for our community members. And so how do we create partnerships that support each other with that? Whether it is encouraging folks and helping people access routine health care, because so often they're ready to access that health care now, and they need to be able to make sure they get good preventive services, they get their kids immunized, or the whole area going back to school. How might churches provide a safe space for a small group of kids the same time each day? And this is the same group, so that you can safely help support them, whether it's in supporting their online learning or helping childcare during a pandemic so the parents can work. There's so many ways that we can work together to find out what the needs are and do that. So I think all those areas of that good know and work and link with your community and be the church every day are really important. And then the other area you asked about is how do we come together as a church, that whole area of worship.
Yeah, it's a big one. A lot of folks are yearning to get back to the table.
Absolutely. I think we've learned that church is such an easy place to spread this virus. We want to be back together, and we're close. We want to hug each other at the peace and shake hands, and we care about each other. We're a family, we're a community. And so it's an easy place that when we come back together to want to just immediately go back to how we've always done things. So we know that's challenging. And it's also where we sing and speak loudly and joyfully and make a noise. And we want to do that. But we also know that is a risk. And so we certainly have seen a great many, I know in my state and other places in the nation, church-related outbreaks. When folks have come together and done those activities without precautions. But all that said, I think we're also seeing that the church can be a beacon or an example of how to do precaution measures effectively. Because there are things that we can do to come back together and with precautions do so collectively. So we know that when churches come back together and they use masks and they do that that physical distancing, they meet, or we meet outside. My church has been meeting outside, and we sit in chairs in our family groupings with our masks on, and it's been doing fine with that. In small groups, we have the same groups each week that we do that with. And so, there are ways that we can do this, and we can actually model that for our communities. Because all these prevention measures are really aimed at helping us get back together to do things, is just doing it in a safe and different way. Thinking about music other than all of us singing in choir, alternative music. Can someone play the violin or do another methods or use a taped music? We can still enjoy music. We just need to do it in a different way right now.
I like this idea of the church being an example of how to do physical gathering in a way that is safe and being a demonstrator of that safety.
Absolutely. We can lead the way with that, and then people carry that over to their work site or their other, because all of these measures are really meant to allow us to get back together as a community, whether it be in worship or whether it be in business, or whether it be in getting our economy open or our kids back to school, is learning to dance with this virus and find ways that we can come together as community and sustain community and keep our operations going in ways that keep us safe.
Yeah, I think right now there seems to be a battle between safety, physical safety, and mental health and community building, because we are communal creatures and we need other humans. And so I just wanted to hear more about, how does one start to craft the best methodology for doing that?
Yeah, and I think so often we set things up as dichotomies. It's health or economy, or it's physical health or mental health. And, reality is they're a lot more integrated. And we need to change those ors to ands. It's those prevention measures that allow us to do health and economy, to do worship and safety, to do physical health and mental health. But I think we have to be intentional about it. So often, I think one of the things come in packages. They're not always good or bad. They kind of come together. And we have to find creative ways to address them and to recognize the pain and the challenge, but to be there for each other through that. I think one of the blessings I've heard come out of this is when people have intentionally reached out to others and created relationships in new ways and found new ways to connect. That's been a positive and a blessing. Or families that have said, we're working from home and we actually are spending more time together in a different way. At the same time, the stresses of this are really difficult. And I think that we have to recognize the normality of that and forgive ourselves and others with some of that. And build that ability to support each other through it. I think we go through cycles, and that we talk about the emotional life cycle of a disaster and in floods and other things. And I think we're seeing the same here. I think you see it in pandemics as well. So those first few months, we kind of had that heroic stage. We are all in this together, and we can do this, and we'll make it work. And then the reality hits that, wow, this is really hard, and it really is real, and it's with us, and it's going to be a long time. And we start to kind of see that drop down, and it gets worse, and people get angry, and they get frustrated, and they get divisive, and they blame each other.
We haven't seen any of that happen, Cathy.
No.
I don't know what you're talking about.
And so then we kind of get to that point of we've got to figure out a new way, and we kind of come to reality again, and we start to kind of come back up and find ways we got to make this work and pull back together. And I hope we get there.
I hope so that we get there as well.
In an ideal world, we think about how do we get there. Yeah, and how do we get there in a way that by the end of the day we actually learn from it and maybe have a better level of functioning than we were beforehand. So I think
we're not just trying to get back to the normal. We're trying to get back to the normal in a way that actually builds a more resilient community.
Exactly. And so I think there's where faith and hope and creativity can move us forward.
So can we go to the faith and hope land? How I want to end our conversation a little bit is, you are a woman of faith. You are a scientist. You are a public health official. You are all of these things. How is God, Christ, your faith helping you get through this? Or where's a story of hope or grace that you have experienced that is helping you kind of get through all of the mess of this time?
Wow. There's so many areas to go with that. It's a hard one to synthesize into a moment or two. God calls us to be in relationship with each other. And there are opportunities here to do that they push us to do it outside the way we normally think about it. And in every disaster, every crisis, there's opportunity. And I think in being quiet, in listening to God and listening to how He speaks through others, there are ways that open our minds to new opportunities. So whether it is connecting more intentionally and seeing new ways to do that, whether it is listening and hearing the pain of others in a different way, that opens our eyes to opportunities for ministry and growth and community transformation coming out the other side of this, whether it is building relationships that we didn't have before, or potentially uncovering the divisiveness of society and understanding the need, the role that the church and that we as individuals of faith have in creating safe space for community dialogue and understanding each other. I think going through difficult times helps us uncover and remind us of those things that are there every day, and maybe calls us again to addressing them with greater vigor. And I hope that we will do that collectively moving forward. Yeah.
Thank you, Cathy.
Thank you.
I'm going to stop recording.